I'm sure I'll stop.
It's working.
Because it's time.
I don't. I can't whisper anymore.
Yes, we'll go ahead and call to order. Yes. Thank you.
United States of America, to the republic for which it stands, the nation under God, indivisible, with liberty and justice for all.
I'll go ahead and call roll. Committee member Grants,
Here.
committee member Schumacher,
Here, present.
committee member Knowles,
Here.
committee member Horton, vice chair Dalton,
Here.
Chair Ray.
Here.
All right, we have a quorum.
Alrighty. Are these the minutes we need to approve?
So when you're ready, I can entertain a motion in a second.
And this is not last month's because we didn't have a quorum.
Correct.
Okay.
So I prepared a summary and I just went ahead and posted those. They don't require approval, so they're
Okay.
already live.
Awesome. Just wanted to confirm. I figured that was why, but I was like, I should ask. Sorry. Sorry.
It's not me.
I was like, Bob, what are you doing? You're
Oh,
giving feedback.
Turn my phone off. Sorry.
Pretty good voice, wasn't it?
Yeah.
Do we have a motion to approve the minutes?
I would move to approve.
Do we have a second?
I will second.
Committee member Schumacher,
Yes.
committee member Knowles,
Yes.
vice chair Dalton,
Yes.
chair Ray,
Yes.
and committee member Grants.
Yes.
Okay. I was seated way back because I didn't want to.
Poke her nose with it. So
Oh,
Poke your eye out.
he said if I sat too forward, it would give bad feedback. So I was like,
If
you go.
oh, okay. Sorry,
if you don't speak it, it'll zap you. So
everyone.
just beware.
All right. And then I want to go ahead and recognize the visitors in the audience. Does anyone want to speak or have anything to say?
I'm Audrey Calderon. I am the community health
Are you
worker.
Oh, are you guys from Exodus? Okay. Well, do you want to?
I think you have somebody online too.
Is there someone online? Okay. Oh, I do know Audrey. Okay. And then community partner presentations, Exodus Recovery Services. Okay.
Hey, I don't like public speaking, so. Can you hear me? Yeah, it was there. Okay. Hi.
Hi.
I'm Lisa. I'm one of the, so this is Exodus Behavioral Health, and so we did the, we just joined the chamber and we did the business after hours, and Miss Nair told us about some of these other things. So we thought it would be good for you guys to know what we do, because this is kind of us like figuring out what this is kind of like she is. So I have no idea we'll do the slides, but I don't know what else you guys want to know about us. But so we are mental health and substance abuse disorder a treatment facility down by the Steelhead Fitness. We bought the fabric shop and expanded that a couple years ago. So, I guess the next little slide, who we are, pardon the things that need edited, but so we started as Country Counseling in Exodus in Harrisburg. So we are located here, Harrisburg and Springfield now. We are now Exodus Behavioral Health because the Country Counseling owners wanted to retire. So we changed, and we have a new boss who was also working at everybody's the same people. It's just the owners retired. So so we have a place so we can have both addiction and mental health, and we share clients quite a bit. We are now a dual diagnosis certified entity, which means we can treat both and share people. We are a level 1 outpatient treatment facility for that.
Okay, thank you. Good afternoon. I'm Liz Chance Tracy. I'm the executive administrator, and we are 0.5 level of care and also 1.0. So we not only do like education for like DUIs, but we can also do groups of or deliver services up to 6 hours a week for an individual that is needing more than just an education. So we do have the three locations, and at each location, we do have both mental health services and SUD services. We did bring some pens and some brochures. I realize we're in Sweet Home, but I brought a brochure for each location just because we have all the locations there. So, and then I brought some cards for Lisa and myself. So, so Lisa is correct. We started off with Country Counseling, and then the owners retired, and one of their staff members went ahead and purchased Exodus, and then later on she decided they closed Country Counseling, so she decided to get the COA for just to broaden and make it both mental health and SUDS, and so now we are certified for co-occurring. And a lot of our therapists are co-occurring themselves, not just that we have, a therapist that we do have some therapists that just do mental health and some that do just SUDS, but we have a few of them that will do both.
So I'm really hot, sorry, because I'm
You're good.
nervous. So ongoing, types. Okay, so next slide. So types of the services. So first of all, the SUDS, the substance abuse disorder, ongoing recovery support, relapse prevention, MRT, which is a group, DUI. We are certified to meet DUI criteria. So we do get a lot of referrals from around all over the place. The POs definitely know who we are. Women's group for SUD. So specifically women, referral, we help people get into residential treatment. And then we also are part of the community court, which just happened today. So the next one is peer support. That's intake, skill building, case management, referral services. They do helping. You can go to the next one. So that's a brief version of what peer support offers. Helping with job applications, getting on the housing lists, signing up for OHP, things like that. That's the majority of our clientele is OHP recipients. And it's really nice because OHP has never limited sessions, and they're very, very supportive of the mental health stuff and the drug and alcohol stuff too. One of our peer support gals is getting trained to help people sign up for SSI and SSD. And so when they do the applications for that, having that certified person kind of put their stamp on it, helps the process go faster because it means that their application is very complete. So they don't have to get it sent back and with all the paperwork that might be missing. And oh my gosh, if you've ever seen those applications, it's a nightmare. So and then mental health, that would be the next one. I'm the main mental health person in Sweet Home, but we do have another gal. She just graduated. So she's kind of taken a little bit of a break because she got her master's, which is really cool. But she'll be picking more people up soon. But we talk therapy is mainly what I do. I do play therapy. I see pretty much everybody. There's really not many, I don't know what I wouldn't see. So
She's talking about age limit too, so she sees younger children all the way up to adults.
yeah, I've had
Men and
from, I
women.
think 6, and I think my oldest gal was in her early 80s. So, and then EMDR and trauma treatment, that's my very favorite thing, and anxiety. So EMDR is a quite a certification that I'm working on, but I can do some of it now. But trauma and anxiety is my very favorite, but I treat anything. Support group, so DV, so the domestic violence group, I've done one in the past specifically for women. I don't have enough people right now that consistently attend their appointments to have a group right now, but I will. And then really anything of interest that people might want to do, like a depression group or an anxiety group, or just basic skills kind of group.
And we currently just partnered up with DDA, which is Dual Diagnosis Anonymous, and we are in the process of. Thank you. Sorry. We're in the process of, we already have a meeting here at the Sweet Home location. And we're in the process of implementing a syllabus for us to have a group because, mental health and SUDS a lot of times really go hand in hand.
Mhm.
And so a lot of people may, unfortunately go back out there because we're only treating like the SUDS. And we really like the fact that we're able to do a wraparound service and really be able to assist on treating both if that client is willing and ready. So we want to support them. They're both behavioral health and also, the family and the community. So we're in the process of doing that. We already got the DDA group going. I think we did our first one a week or two ago.
I think so. I don't know if anybody came to it.
Oh,
but
well,
it's
but we
available.
had it. We had it. We had snacks and everything, I'm sure.
We did.
I have a quick question about the support groups.
Yeah.
Do they have to be enrolled in your other services, or is that something you offer that someone from the community could come to if they are experiencing that or have experienced that?
That
We would have to have them enrolled just for
Yeah.
confidentiality and, CFR 4242.
sure, all the
That's-
numbers and
yeah.
letters. That's so
Is that
nice
what
of
you're
them.
gonna say?
Yeah, kind of, yeah. So having them see me individually also just to check in with how they're doing, but I don't know. And for billing reasons too, billing stuff, yeah. So yes, they would be enrolled. That's what I was gonna say. Anybody can be self-referred. They don't have to have a doctor's referral to see us. Most people most of my people walk in on their own. The other side, not necessarily, but they we're pretty cool. They like us quite a bit. They keep coming back.
Support them because if they're going through these, like the DV group, that can be very triggering. We don't want, okay, that was a little too close. We don't want them to go into a group, process something or hear something from another person and then leave and then just really be triggered. So we want to really be able to, have them in our services and then have a qualified facilitator. So if they are being, triggered, then they can assist. And they'll have a background of what they're doing.
How most of the groups work anyway is you would see somebody at least once a month individually just to check in and see how you're doing. So the next slide, resources, we have Narcan. We have a Narcan distribution center. We have gun locks and we have our coffee and snacks on hot and cold days. We let people hang out if they're appropriate. Sometimes they are not, but for the most part, because we do serve a lot of homeless folks too around. So sometimes it's just nice to come and get a cup of coffee or to warm up or whatever. So let's see. That's pretty much it, I think. We're gonna do the health fair at the high school in August, I think. Yeah. So yeah, the next one.
You passed that test. Come up with August. Thank you.
It's August 17th, I'm pretty sure from
You
9
got
to
it.
2. Yes. Oh, yeah, because I sent you the
That would be me.
the invitation. Okay. Yay, we did it.
We'll have snacks there.
We will do. have snacks. My supervisor told me this morning that people avoid mental health booths unless you have snacks.
That's something that,
So,
Dick Knowles has been representative of that group for a very long time. And that's kind of a common thing we see is that stigma that surrounds that people have a tendency to go around it.
don't ask me how I'm doing. Please don't ask me. Don't make eye contact.
And it's how we describe mental health. I mean, to me, mental health comes in such a variety of layers. Yeah, I mean, it could be you lost a loved one.
Right. You don't have to
You're
something
struggling.
wrong.
You lost your job.
Yeah.
Person loses their pet they've had for 20 years. They're struggling. And sometimes it's the health of a healthy mind is like why I look at it. Do you have, are you healthy? How are you feeling? But again, it's being able to openly express that without judgment. And that's,
And that is kind of scary. The first couple sessions is really their interview for me too, to see if they even want to come back and talk to me. They feel safe talking to me. So that's my job, just to make them feel safe and
and
comfortable.
it's not just around mental health. I mean, you could have a booth on cancer and people, just those negative words that
Mhm.
people hear in their life and they have a tendency to steer away from it.
Right.
That's a
And
challenge.
I don't want a diagnosis, I just need to talk about something. So
Yeah.
How many
yeah.
peer supports do you guys have?
We currently have one on staff and we are in the process of having another, they're in the process of onboarding. So that might be a minute, but we definitely, one really good thing about our staff is they're willing to go to different locations. So our peer support actually is like housed here in Sweet Home, but she willing and does come out to Springfield and she'll go to Harrisburg also. So yes.
So how many therapists do you have on staff?
We have, there's 15 staff members completely. So we have, what we have, so there's 2 billing, there's me, and then there's Emily. So probably 10, 11? Yeah, somewhere around there. We have 15, we're kind of a small agency for sure. And there's 15 of us for all 3
All 3?
locations.
Okay.
So
Okay,
yeah,
that
that's
was my
including
question.
office, that's including billing, that's including therapists, yes, and our peer support.
So what's your biggest challenge that you face?
I think one of our biggest challenges right now is that we're really trying to get the word out of where we're at and who we are, and we want to really just support the community and support, that individual that walks in and their family members and help them, guide them because they're doing all the hard work, right? We're just there kind of guiding them. So that's one of the biggest things that we're working on is just really getting our name out there and letting people know that we're here, we're here to help.
That was, it almost was another question I had down there. That part of that challenge was how do you cross over and let people know? How do you work with the school districts and other services like Samaritan? How do you pair that?
We come here and talk to you guys about us, and we have pens. We have plenty of pens over there, and we're leaving them for you guys, just so you know, and
So-
brochures. So yes.
Chair Ray, if I can, I just want to say that I did attend the business after hours and I've heard of Exodus. I didn't know what they did until I was there and I was impacted by how much they offer to our community and what a valuable resource it is. So that's why I invited them, is because I figured everybody needs to know who they are and what they're up to and the good that they're doing. So yeah, they are here at my request to share with all of you because you guys are movers and shakers in the community. So you can continue to communicate what they're up to. So.
Thank you.
So
Yeah.
also you have these clientele that come in. Does insurance cover these services?
That was my question.
Yeah.
What insurances?
Yes, most of our clientele is, we do have a lot of clients that are on OHP. Some are self-pay, and we are in the process of trying to credential more with the commercial part. Huh?
Intercommunity.
Yes, we are, but the Samaritan, the commercial. So we're also we're in the process of trying to get commercially contracted too. So yes, so insurance does pay for both the behavioral health and both the mental health and the SUDS.
Because I know that's another reason why a lot of people don't access services. It's like, I don't really have the insurance or the ability, or the insurance I have doesn't cover that, so I have to add this one. So I know that's on a lot of people's minds out there.
People, insurance, and then they don't understand it, or they forget to reapply and it lapsed, or they haven't applied at all. And our peer support can help them do all those. She can help them apply. She can help them reapply. We can figure out, if it lapsed, when did it stop? What's happening with that? And we definitely want to assist them, because it's not just for them to use it with our agency, it's them to keep healthy overall as a whole.
Sounds like you're doing some awesome work. Appreciate you being here and
Thank
what you
you.
do in our community.
Thank you. Thank you for inviting us. Thank you.
If an agency wanted to refer, would they just have the patient call, or are you set up with like Unite Us for referrals, or?
We currently are not.
Okay.
But they can absolutely give us a call, and then we're happy to, get that referral, and we will work with them. Yes.
Okay, awesome.
And we also do referrals to other agencies too.
Okay.
If need be. Yes.
So I could give your information to, like I volunteer at SHEM. And
Okay.
so SHEM, because we see a lot of homeless people there and a lot of people who are in need of mental health. And so,
Yes.
yeah.
Yes, please.
Yeah, there's the huts, I've been down there too, and I've talked to some of those people, and they do come in, and they, like, word of mouth seems to have
Mhm.
been pretty good around here so far. Like, we haven't really had to advertise because, again, the POs know who we are and things like that. So we do get a lot of folks even without the advertisement. So, but having our word out is going to be even better. I did have one guy last week say, just tell everybody about that. You need to go down there. They're really cool. Like one of our dual diagnosis guys. So he said he's our biggest cheerleader in town.
Well, I know you guys get a lot of community court referrals because I attend community court too. And yeah, there's always people at the access table, and I'm like, where are they located? Are we referring people there too?
Chair Ray, the door is quite hidden, but it's many people know where it's at, but I didn't know where it was. But I also want to say that they're connected with Sean, and he sometimes attends these meetings as well. But he knows of them, and he often sends referrals their direction as well.
Awesome.
And so,
Okay.
yeah.
Yeah. Big dial.
You connected any with the school district?
Not yet. And since like coming here, I thought, oh yeah, that was one thing I wanted to
Yeah,
reach out to them for. So
Do we have anybody that could make a connection with somebody at the school district?
I think I could
Assist
help
with
you with that.
okay.
Because I know there's a need. Dick and I sat there with the administrator, I guess it was last year, wasn't it? And when he told me the statistics in our school system, I was shocked. Didn't,
Yeah,
children that
kinda-
are struggling, and children down to third grade levels. And I just can imagine a child struggling that much. But, depends on their condition, their environment. It all
Yeah.
plays part of it.
Yeah, Sweet Home is its own world here for sure, with its own like unique issues. But since COVID, I've had lots of teenagers who were perfectly fine before have like social anxiety and won't go anywhere, and that's why they're coming to see me, or they're being dragged to come see me, is because they have just dropped off, which has been really sad.
Chair Ray, can I ask a question?
Yes.
So would you guys like to be advertised for a heating and cooling shelter? We have a list that we advertise through the city for heating and cooling shelters. I saw on one of your slides, you said you had AC and heat in the inclement weather.
Right.
Okay.
And we do have it open for our clients that are enrolled, but because of the confidentiality, it
Makes sense.
we're unable,
Yeah.
so. You can advertise us other ways.
Chair Ray, Wanda has a question as well.
Can I get you at one of the mics so that we can pick it up on the? Thank you. I was gonna say, we've got a few open.
We have wireless if you want that instead.
I just wondered if you have a wait list. Like, how
Not
long
right
does
now.
it take for someone to get in for their intake appointment?
Tomorrow. Well,
Oh, wow.
we have lots of openings, but yeah, like I don't have a wait list right now, and I haven't for a while. It takes a little bit of time to like process insurance and stuff, but
Right.
within the week.
We can definitely. And I know this is sweet home, but we definitely, if they're open to going into other sites also. So you can have it spin. And if you have, the insurance company is calling, and 'cause I used to work at a different facility, and I would do all their prior authorizations for residential. And, they would call me saying, we have somebody, can you, is there any way you can get this rolling? And we would do that. So, you're saying, hey, we have a person that we're case managing and they could really use this. Definitely.
Right.
Happen.
Okay.
We do telehealth also. I forgot.
Oh, that's
We do
good.
telehealth, or yes, we do telehealth. Yep.
You have to say that all again into the mic.
We do telehealth.
I just want to clarify because I think I wrote this down wrong. Do you bill all insurances or just OHP? Okay.
No, we currently are credentialed with IHN,
Okay.
Trillium, and Pacific Source in the Medicaid, the OHP part.
Okay.
We do have a couple of therapists that a couple of therapists that is credentialed with the Pacific Source commercial part, and we are just now moving into trying to get more credentialed in, the commercial part, like
Okay.
Samaritan, and not just IHN, but.
What about the Oregon Health Plan open card?
Absolutely.
Okay, sweet. Thank you. Those were all my questions.
Yeah, I'd like to be credentialed with VA and which one is it? What's OHP? Medicaid or Medicare? Okay. Medicare, now we're doing a lengthy process on it. For a long time, they wouldn't cover anybody under a PhD level. So at this point, we don't have anybody like that because the owner retired who we were working under her license. So that's a barrier at the moment, but I think they're working on that application because they just opened it up recently for us. And then Blue Cross Blue Shield hasn't,
Yeah.
I got to reapply to that.
So we're just really in the beginning processes of trying to get the commercial end piece
Okay.
going. And it's not, I mean, it's lengthy.
It takes time.
Yeah.
I'd like to get your call.
You mentioned VA briefly. Are veterans, do you do choice like for veterans?
So, TRICARE
TRICARE.
choice, I don't believe we do that right now. We can actually build Champ VA
Mhm.
because Champ VA is a no barrier insurance and they don't need referrals or we have not done that yet, but I do know we can.
All right.
But
We have a lot of veterans at the senior center and I'm
Yeah.
also part of that too. So.
absolutely. My husband is a retired veteran.
Mhm.
So that's how I know.
Okay.
And they also have their own programs over there. So,
Yeah, but
they
they're far away.
yes, absolutely. So yes. So like I said, Champ VA is a no barrier, and I know that because that's the insurance that I have. No barrier. They don't contract with any specific agencies. You just do service. If it's one of the things that they pay for, you bill it and we're good. There is a small funding for veterans if they do, for the SUDS DUII. I don't know how much that is.
Mm.
But I do know that we have a small funding for that.
Okay.
I am a veteran, so I really like talking to them, and it seems like that breaks down the barrier of, because I kind of get it, I guess. So yes, I would really, really like to work with veterans.
Yeah, I spent 25 years at the VA, so.
Okay, I don't do it myself. I ran far away from that, but
So one more, just last question from me. What happens if somebody comes through the door, they need help and they don't have insurance or any kind of coverage? How do you approach that?
Did I take the mic? Yeah. So if somebody comes into our doors and they are needing services and they don't have OHP currently, we would connect them with our peer support for them to apply for OHP. We would do everything we can to help them to get what they need for their whole life, right? As far as health insurance, it's not just for us, it's for them to be healthy all around. We do have a sliding scale if they do not qualify for OHP. And we do have a DUII funded slot, and that is also limited. But we want to be here to help. We really want, because we know if we can help one person, that one person's actually really healing more, because you're the family and the community and the children. So we really want to help, and we're going to do everything we can to assist them.
Thank you.
That was gonna be my question today. I was sliding scale, but it worked out. Does anyone else have any questions? Any more questions?
Thank you, both.
Yes.
Yeah, thank you for coming today.
Absolutely. Thank you for inviting us. We're going to leave those cards and those brochures and those pens. Use those pens.
Oh, yeah. I love a good pen.
Another popular item in the event category.
Yes.
That and candies.
That's right.
People collect them.
I love it. And I brought a few of them for sure.
To speak back to what you guys were saying earlier about no one wants to come to a mental health booth, if you put pens out, the people will come.
Okay.
Regardless.
We're
of
going
the-
to have snacks and pens
Yes,
then.
there you go.
And I was at an event on Saturday and they have little pulley toy things now, just stretch relief kind of thing. That is the most popular thing I have ever
yeah.
in 12 years of doing this. What a remarkable, and I thought, everybody under the age of 8. Nope, 20, 30, 50, didn't make any difference. Oh, boy.
Yes, absolutely.
I'm usually working at the event, so my mom will take my 2 little kids around and they'll come home with these goodie bags full of pens. And they're like, Gammy says that's the best thing at the resource fairs. So then we just have random pens. But my mom's like, oh no, it's great. Cause then I stand there and I talk to the people at the booth and I'm like, cause I'm thinking, oh my gosh, my kids are just going and stealing a million pens. What is happening in this world? But
Well, for kids,
yeah.
for kids, the health fair is like Halloween.
Yes. Oh yeah.
Chair Ray, how long has the health fair been going on?
This is the 7th year.
Yeah.
Seventh year.
Day 7.
So thank you, Exodus, for coming to participate this year. Yeah.
Absolutely. We're looking forward to it.
Yes.
Oh, which one of you do I need to, you? Which Lisa or
yes, I'm Lisa.
Parsons?
Yeah.
Okay, got it. You're on my list.
Okay.
Thank you again.
Thank
Thank
you.
you so much. Thank you. I appreciate it.
Did good. You
Yeah.
don't need to be nervous
Yeah.
next time.
It was a great presentation. Alrighty, old business. Resource list update. Let me go into my handy dandy notebook here. I should have printed this out.
You look natural sitting there anyway.
How should I have it currently on my notebook.
You want me to start asking you questions?
I mean, I
Pop quiz.
recommend, are you completed with your work?
No.
Okay, so I would just kind of
Yeah.
state where you are, what your strategy is, how your board members can help you.
So far I have Sweet Home resources. Are we wanting to expand this to Sweet Home and surrounding areas resources? Because I just have, there's a brick and mortar in Sweet Home for this resource currently. Here's the address, here's the website, here's the phone number, and here's the services offered.
We can add this one to it now.
I have it on there actually.
Oh, man. Okay.
So, and I don't know how many of the outside, how far out I mean, I look at the applicants for the health fair. I mean, Albany, Lebanon.
Yeah.
So I don't know if that list is a good add to
And-
that, but
And I know, if I might, I know we had talked about inviting the 2-on-1 people to talk to us about and I did talk to Shannon, who's more than willing to appear and even take abuse. So I think I can get her here next month. It might help to kind of
Yeah.
solidify this.
Yeah, so far I have it broken down into categories. So I have medical, treatment and recovery, food, shelters, transportation, childcare and preschool programs, and utility assistance. Because for me, that's everything that falls under that
Housing.
social determinants of health
Housing.
umbrella. I
Housing, maybe?
I don't have housing. I have shelters, but we don't have like a housing agency per se. Like, but if we're expanding, I could add like
Well, I was
Benton Housing
thinking
Authority.
Housing
Yeah.
Authority is what
I was thinking maybe the goal of expanding would be is like if something was offered in Lebanon that we didn't have here. But I don't know, what Lebanon offers that to have more than we have here. So that would be the question.
I stepped out for a minute, but I just want to inform you all, if you didn't hear last night at the city council meeting, we approved for the city manager to finish negotiations to have CSC move into this part of the building.
Wow.
So for future, it might be good to collaborate with them as far as resource lists, because they often have a good exhaustive
Yeah.
they
resource
have a
list.
huge book,
Yeah.
CS,
which is seldom updated.
Community Services Consortium.
Yeah.
thank you. Oh, yeah, they hand out those notebooks, those little pamphlets every year. Yeah.
That's right.
and they've always been a part of the health fair too.
Mm-hmm. Is that like permanently moving into that space, or they'd be here like a few days a week, or?
Oh, no, they're bringing everything in.
Oh,
The
awesome.
whole space, monthly rent,
Wow.
job training, hiring up to like 30 employees. Like,
Oh,
yeah.
wow. Okay,
Yeah.
awesome. Thank you.
There's more involved than that. You should ask Kelsey about it, though. The other Kelsey about it.
So that is where the resource list is at. But before I threw myself into adding in Albany, Lebanon, Brownsville, I wanted to get a consensus of what we wanted the resource to look like if we're putting it on the city website, because there is I know Lebanon, if you go to their city website, they have their own resource list. Do we want to, I mean, I don't know, maybe add a hyperlink to that if they are okay with that, and that's something we can do within the rules of what we're allowed to do.
I know,
Absolutely. And I would also say if there are resources not in Sweet Home where we have Boyd's, I think it's for the service of the community to include those things.
and I think with the heavy emphasis on peer support, there are folks who actually have an office in, Benton County and they drive here. Who would that be?
Yeah.
But, so I think that might change a little bit. So not to add more work, but
Yeah, I mean,
where to cut off.
it's
Yeah.
okay.
Yeah.
No, we can help.
Yeah.
Okay.
Well, and there's also some of these agencies, if you were to walk into the community health centers of Benton and Lynn counties, you're going to meet with the health navigator who's going to give you an exhaustive list of all the resources that you can find and you can access based on where you live, what you qualify for, those kind of things. It sounds like Exodus has a similar thing. So I just didn't want to, I have a tendency to dive in and devote a lot of manpower to things for someone to be like, oh, you didn't have to do that much work. And I'm really busy, so I didn't want to do that. So I think, yes, exactly. That's why I'm in this chair. So I really wanted to come to the group and say, this is where I'm at currently. What else would you like to see before just doing that and being like, oh, Kelsey, we don't need Lebanon on here. It's 20 minutes away. So that's not how you talk. I don't know why I did that voice. But anyways,
Oh,
okay.
that wasn't too bad.
That's where we're at with it.
Well, I was
So,
thinking the hyperlink is a great idea. And
Yeah.
the other thing that's always in the back of my mind is accessibility. You know, people that don't drive. I
mhm.
mean, the Blinn Shuttle does go to Lebanon and can take them to Lebanon and does go to limited areas in Albany. So the accessibility, Lebanon is definitely a helpful place for them to get help. But beyond that, if they're not driving, and
Yeah.
it's hard for them to get there.
And that was my other thought process is I have worked at agencies where I have seen people just hand someone like a book resource and it's like, oh, look at all these great resources. And they're like, none of these are in my area. And then it gets really frustrating because it's like, oh, look, all this help I can't get or I can't access. So I also didn't want to be like, oh, come to the Sweet Home City website. Well, you'll see all these things that are not located in the Sweet Home City limits. So yeah, I had a similar thought process, but I think if we are able to share the hyperlinks for the other resource lists that already exist on the other city websites, that's a great idea too, because if it is someone who's like, oh, I do have access to go to Lebanon, I can make it to Brownsville, I can go to Harrisburg or whatever we're else close to, all the places, they can then access that list. But then if it's just Sweet Home, it's also a list that our community partners within Sweet Home can print out and post because it is like the basic, I don't know if you guys can see this. So like if they posted it, you could just hang that up on your bulletin board because it's just, yeah, just a couple of pages. You have an address, you have a phone number, and you have the bare minimum of what they do and what they can offer for you. Whereas some of them are very exhaustive lists with hours and things that actually don't even exist anymore and have changed. So that's where it's at.
Job well done.
Oh, thanks. I was sweating when she asked me to put it on the agenda. I was like, oh, I don't know where we're at with that. So sure.
Well, the hyperlink thing to me makes it more simplistic and easier to manage that resource list.
Yeah. Well, and I also included like the web pages for the sites because if they're accessing it through the city website, then they have access to a computer and then they can go and see the more exhaustive list of the updated hours and everything on that page's own website because those are more likely to get updated than if we include every single detail from the website on ours and it's like, oh, they changed that and we weren't told. So
Wanda, I have a question for you. From Samaritan standpoint, do you keep that sort of list available out there for?
We do, yes, and we use it often. But I would say the biggest challenge is people don't have transportation and things aren't available here. And so if we don't have something to offer here, it's challenging to try to coordinate them with any of the SDOH needs. So I think that keeping it more simplistic because we have booklets that have all the information, and then we have handouts that are 15 pages, but you go through it and there's nothing in Sweet Home that matches up for what the patient needs. So that's a big struggle, but yes.
One thing I see that Samaritan and their services has done is your screens, visual screens, you scroll a lot of info. And I, as a patient going there and sitting down and instead of reading the local tell and sell, you get to see what's there. And a lot of times I picked up on stuff that I didn't know. So I think even that visual aid helps a lot when you're just sitting and waiting for your appointment. You see that a lot. I've seen that in other places too, but I think that's a value. But thank you.
I have a question then as well for Wanda, if that's okay. Do you guys have the availability to link them to the Lynn shuttle that runs throughout Sweet Home and into Lebanon and Albany?
Yes.
Okay, good.
Yes, we work with Lynn Shuttle pretty closely. and
good.
We actually have vouchers because we have patients who can't afford
Right.
the fee, so.
I've spoken with a lot of people in our community who have no idea about Lynn Shuttle, and it's such a huge asset to our community. So,
But you also run into that small population of people who have maybe been trespassed from the bus, or they do not like to access public transportation for whatever reason. So I agree. There's some times where it's like, no, if it's not a local resource and we can't provide any form of some sort of private transportation, they're not going to be able to access it unless we can get it to them and deliver it to their home. So I understand that need is out there as well in our community. Anything else about the resource list?
I got 10 more things here to, no,
Oh, my eye just started twitching.
Take a breath. It's all right.
That's a hint.
Yeah. That's true. When would the city like this resource list in its completed state?
I would say, first of all, whenever it's done, but again, technically by code, you have a spring annual reporting requirement. So I think certainly by that time that would be
Okay.
appropriate because we can include it with that.
Am
Spring
I?
of 2025, you're saying?
Yes. Yeah, because I think we found out about that deadline, like,
A few meetings ago.
yeah, but like right before the deadline would have, and I
Yeah.
was like having heart palpitations, and you're like, no, you can do it next year.
Yeah.
So I was like, cool.
The other, to shorten the goal, we could look at the health fair because
Yeah.
we have classic time to hand it out.
Is there anything against me emailing the list to everyone else on the committee and having them review it to see if anything's missing? Or,
No,
I just am not going to send the emails and break the rules. So I just figured
honestly,
I'd
as long as you're not replying all and starting a conversation, you
Okay.
can send it out. Just send your additions back directly to the chair, and that is perfect.
Super.
Fine.
Awesome.
It's whether we get chatting back and forth and making decisions.
Can I get everyone's emails? Because I don't think I have everyone's emails.
Yes, I can
But
send that to you.
I think that would be a better way to have everyone just review it and be like, oh, hey, I know of this resource that's missing. Here's their contact information, or try harder. It's,
Just,
You know.
just because we're talking about it, that is troublesome. And I got the same comment over my shoulder that's in my brain. I'm afraid of breaking that rule. I don't even know what the rule is still.
Chair Ray.
But we should write it down.
I just ask a question. Anytime I'm like concerned or confused, I'm like, hey, Cecily, hey,
Cecily.
Kelsey, help me.
Well, that's what I mean.
Yeah.
Yeah.
Basically, we just don't want a virtual quorum to occur. So if we haven't noticed that you're discussing committee related business, it shouldn't take place in email, in person, whatever. So basically, I just recommend it's fine to email everyone, but there should be no reply alls happening.
And Chair Ray,
Ever.
if you put everybody in the blind CC, they can't reply all.
Okay.
They'll only be able to reply individually. And so,
I just didn't know. For some reason, I had it in my head that we weren't supposed to be like emailing at all.
I had the same.
You may email
you may email.
individually.
Okay.
Just, it's when you get into the group
We have the
chat
same.
that it's an issue.
Okay.
Just
That means
never
no
hit
dinner
reply all.
Together.
Well, no, but
You can have
sometimes
dinner, just don't talk
like-
anything health related.
because other
I can
committee
talk
members
about my
will
heart
be the
palpitations.
ones like, I'm trying to figure things out here. Other committee members will be the ones that are in contact with someone who's going to present. And I'm like, do I get to email them and ask if we have confirmation?
Yes, you can
Yes.
absolutely do that. That's fine.
Okay, that's good to know. Just, yeah, I understand it. It can't be a conversation back and forth, all of us together, or even more than two of us together.
I would recommend not more than 2. Technically, you can go up to 3, but
Okay,
don't make it difficult for yourself.
but we can talk about things.
Yes.
Okay, that was how I understood it. And so I just wanted to make, okay, I feel better. That's how you explained it to me, actually, if I'm being completely honest. And so I was like, I'm just gonna blame Bob if we're breaking.
That's why I don't send any emails out.
Okay.
And I never listened to him, so.
He just deletes them.
That's why I never respond to your emails, Bob. Anyways, okay.
That's why I'm waiting on that application.
I don't,
I got you.
he sent it to me an hour ago. Okay. I don't have health fair on the list as old business, but I think we do have any updates on the health fair.
Oh, yeah.
Okay. Would you like to share any updates on the?
Well, the end of the month was supposed to be supposedly the deadline to receive applications. I've sent out close to probably 35 or more, and I've got back 19. So before I came here, I was back on that computer reshooting these out, and I got 3 more responses back real quick. But I think it's always a guessing game, you know, when to send them out. You send them out too early, they get put aside. You send them too late, then you're crunch time there. So this year we sent them out in May, and sure enough, I came home. I go, oh no, there's no one showing up this year, but I think they will. I just got to keep after them.
I almost wonder if you should follow up too with like maybe a phone call, because I know from working with community partners in some agencies, there's sometimes turnover and people get in charge and are in different roles in different situations. And it's not always forwarded on. It's just, oh, I don't do this anymore. And it's moved to the trash. So maybe,
Called all these people this year.
okay. I didn't, well,
Before I
just
sent
know,
the
yeah.
application to make sure I had the info right.
I just
So,
know that's something that we've run into before when we've helped organize different community events, and it can be very frustrating because it's like, why don't you just forward it to the person that does that now? But
But
if you've talked to
but I
them, then
do
that
see
doesn't
turnover.
really help. I gotcha.
That's it.
That's the update.
That's it.
Okay. Anything else? Any committee business for the good of the order? I have something. So the community health, the community health centers of Lynn and Benton counties that has an office here in Sweet Home is recruiting for their board of directors. They'd like to have someone from the Sweet Home community, as they do have a health center out here, so they'd like that input. The board of directors is a combination of patients, community members, and staff. They're responsible for governance of the health centers. It consists of at least 51% patient representation, which they're currently meeting. And that's required by law. And the board takes part in organizational planning and actively shapes the strategic planning progress of the CHC. Additionally, they oversee recruitment, evaluation, and ongoing support of the executive director. The commitment is 2 to 4 hours per month. Meetings are in Corvallis, April through October, and then they are virtual from October to April. It's from 6:30 to 8:30, and there are options for additional committees and time to review applications considered in the 2 to 4 hour guide. So if you guys know anyone in the Sweet Home area that wants to join,
Who's the executive director? No.
who's our current executive director? Why would you ask me that? I don't know.
Okay, no, that's all right. No, I didn't mean to test you. I didn't mean to test you. It's a good group. I mean, if anyone knows,
Yeah.
I got this close to doing it myself.
Of the CHCs or of Benton County? Lacey Malel is our interim director.
I know that.
Then why did you ask me that? You're gonna get me fired.
That's why I am.
Well, I didn't know if you meant of the CHCs or of the entire county. I don't know the county director. Any more committee business for the good of the order?
Sure, Ray, if I may. Yes. For everyone's benefit, we did have someone step down from the committee, so there is currently a vacancy. We will be advertising on social media, but if you know interested folks, please send them my way. The application's available on the website.
You know, while we're talking about that, there were people that were coming before. And like Kate Hall and folks like that. Are you okay if I just respond to them and say, you guys still interested? No reason not to, I don't.
I think if anyone on the committee knows of anyone, we should let them know.
The
Yeah.
chief of police used to come all the time. It was
And
people
even
like that.
even if they're not on the committee, they're like Sean isn't technically a committee member, and Mayor Coleman, you're not technically on the committee, so I think it's great to, if anyone wants to talk about the health of the community of Sweet Home, I would love to have them here. I think you can never have, I mean, sometimes you can have too many people in the room, but there's organizations and agencies that are actively working on social determinants of health and things that would benefit Sweet Home as a whole, but they're doing it siloed. And I think this is a great space to bring it to where it's not so siloed and it can help not just our own patient panels, but the community overall. So that's how I feel about it.
I thought I would ask, Kate works for Council of Governments and
Which is
Sure.
a great organization.
senior
Yeah.
services. I mean, you can't.
They have
can't
everything
cover
on the
everything,
umbrella. So
Including housing.
yeah.
So, yeah, I'll
Because we can send that out to anyone,
Absolutely.
right?
It's open to
Perfect.
anyone, especially because you guys kind of have special rules. They don't have to live in Sweet Home, which is
Oh,
a
okay.
boon to this committee. So
Okay.
please feel free to take advantage of that.
Perfect.
I also wanted to ask if there's any interest in canceling the July meeting. We're taking a short recess from council in July. We have 2 other committees that are recessed in July, so it's entirely up to you what you'd like to do.
I thought a lot about this. Because we had also discussed bringing up at a meeting, once we had a quorum, the possibility of going bi-monthly and not meeting once a month because we had attendance had slowed and meetings were getting a lot shorter. My only concern is if there's anything that is needed from us as a whole or discussion or support pre-health fair,
Mhm.
and we don't meet next month, we won't meet again until a week after the health fair, right?
Right, yeah,
would
I think we need to meet next month,
That's
Yeah.
exactly.
with the health fair coming up.
Yeah, that's
I agree.
Okay.
what I thought about today. I was like,
Then maybe cancel August because you'll need a break.
Vacation time.
yes.
We can revisit that next meeting.
Okay, yeah, because that's kind of what I was thinking is I would hate for us to, you need support or help or a call to arms and we're all gone.
I got your email.
You're a good man.
I got your email addresses, got your phone numbers.
Yeah.
I understand the quorum process. We're good.
Okay. So yes, meeting in July, I think that's a good idea. Or yeah, that's fine. I'm not gonna, yeah, never mind. I won't complicate things. I
I
will.
thought maybe you had a vision there for a minute.
Well, I was gonna say if for whatever reason you guys aren't here or there's like a vacation or there's a need for us to skip July, then what if we just moved August's meeting to a different week that wouldn't make it fall? But
We have so many staggered committees and meetings that it is challenging if you take yourself out of your normal rotation.
okay, then we won't do that. We'll just meet in July. Is there any other committee business for the good of the order?
Sometimes. I'm great.
Well, yippee skippy.
If there's no further business, you may adjourn the meeting.
The meeting is adjourned at 4:58. Thanks.
Yeah.
Yes.
Happy to